Very much, Mr. President. I'd like to start by thanking Senator Wyden for his leadership in the fight to protect Medicare and Medicaid and for organizing this time for us to speak on this important subject. I grew up in a three-generation household. My 93-year-old mother has lived with us for over 20 years, and my grandmother lived with us until she was 98. And if I of all people, of course, know the importance of Medicare to our seniors. On May 7, 2015, a full 3 months before he descended a golden escalator to launch his campaign, Donald Trump bragged on Twitter about how he was, quote, the first and only Republican candidate for president to state, and I quote, "There will be no cuts to Social Security, Medicare, and Medicaid." He made and repeated this promise for a reason. All across the country, we know that Americans across party lines care deeply about health care and expect their members of Congress to protect their health care. Millions of Americans receive their health care through Medicaid and Medicare. These two programs have helped tens of millions of Americans since their creation 53 years ago. Medicare provides quality health insurance for millions of seniors, and Medicaid helps them afford nursing home care and other services when they need it. Medicaid has served working families and the poor who otherwise couldn't afford health coverage, helping to bring our uninsured rate to a historic low. And Medicaid is currently helping tens of thousands of Americans receive drug treatment amidst the ongoing opioid epidemic. Again, it isn't surprising that Donald Trump pledged to protect these programs while campaigning for president. They are wildly popular programs for a reason. But it also isn't surprising that almost immediately after his election, Donald Trump reneged on his promise to protect Medicare and Medicaid. It began when he appointed Tom Price, the architect of plans to dismantle Medicare and Medicaid, to serve as his Secretary of Health and Human Services. It continued when the president and congressional Republicans sought to eliminate the Medicaid expansion and cut hundreds of billions of dollars in Medicaid funding during the push to repeal the Affordable Care Act, the ACA. It continued when the administration issued new rules that allow states to implement arbitrary work requirements for Medicaid. 4 states have already taken advantage of this new authority. If the rest of the country follows their lead, between 1 and 4 million Americans will lose their health coverage. And it continued when the president proposed turning Medicare into a voucher program, converting Medicaid to a block grant, and cutting nearly $2 trillion from both programs as part of his fiscal year 2019 budget. These changes and cuts would have a devastating impact on the hundreds of thousands of Hawaii residents who depend on these programs for their health care and their long-term care needs. Medicaid, for example, serves around 350,000 Hawaii residents, including 38% of all the children in Hawaii and 15% of seniors and people with disabilities across our state. These cuts would be particularly devastating to Hawaii residents who access health care through our federally qualified community health centers, many of which depend on reimbursements through Medicaid to provide high-quality care to those in need. And during the height of the debate to repeal the Affordable Care Act, I spoke with Sheila Beckham, the CEO of Waikiki Health Center on Oahu. Waikiki Health operates a network of health centers and shelters in Honolulu that cater to high-risk populations, including a significant number of patients living with HIV and AIDS. If the president and congressional Republicans had succeeded in cutting Medicaid, Sheila would have had to lay off between 80 to 100 workers and close all but 2 of the clinics she operates. Medicaid cuts would also have had a significant impact on women's health outcomes throughout Hawaii. Last year, I shared a story about a young woman named Anne who walked into the Kokua Kalihi Valley Clinic 3 years ago. She had no health insurance, and she was pregnant at the age of 15. The doctors at the clinic helped Anne apply for Medicaid, which helped her afford prenatal care and gave her support to stay healthy and in school. Medicaid helped Anne and her husband Dan, age 17, welcome a healthy baby boy named Joseph. Today, Anne is a graduate of Farrington High School. She works part-time and has plans to become a pediatric nurse practitioner. Her family now has health insurance through Dan's employer. Medicaid also plays a crucial role in providing long-term nursing care for seniors who otherwise would not be able to afford it. I know how important this is for our seniors in Hawaii because we have in Hawaii the fastest growing aging population in the entire country. So across our state, Medicaid provides coverage for 3 in 5 nursing home residents. At Halemakua on Maui, that number is closer to 80%. And without Medicaid, many of the residents would not be able to afford to stay there. One story that stuck with me came from Keith Moniz. After working as a custodian for more than 40 years at St. Anthony's School, Keith's brother, Lester, lost his job and his health insurance. Only a few short months later, Keith's brother Lester had a debilitating stroke that left him permanently disabled. Fortunately, Lester was able to obtain Medicaid coverage and is now a long-term resident at Halemakua. Keith was very clear about what would have happened to his brother if the president had succeeded in making large cuts to Medicaid. And Keith said, "It would be devastating. We had a difficult time taking care of him," his brother, "when he was at home and he's gotten the care that he needs at Halemakua. It would be a big loss. I don't know what we would do. Where would we be able to move him to?" Our seniors in Hawaii, we call them our kupuna, would also be significantly harmed by the president's plans to voucherize and make huge cuts to Medicare. More than 230,000 kupuna, our seniors in Hawaii, or 17% of our state's population, are covered by Medicare. Through its payments to providers and purchases of medical equipment, Medicare generates $2.5 billion for Hawaii's economy. Our kupuna are already struggling with the rising cost of living, and nearly 9% of them live in poverty. Many more are living on fixed incomes and would be especially vulnerable to rising costs under the president's plan to turn Medicare into a voucher program. Last year, I shared the story of Lanny and Ann Bruner from Kauai. Lanny is 80 years old, but he's still working 3 jobs to make ends meet after losing the family home during the 2008 mortgage crisis. And his wife has glaucoma and pays what she calls a ridiculous amount for eye drops. Lanny had a heart attack and 2 knee replacements. Like many of our kupuna living on a fixed income, they simply could not afford the extra money they would be forced to pay if Republicans succeed in their efforts to privatize and voucherize Medicare. These stories underscore the importance of the need for Congress to pass specific legislation to protect Medicare and Medicaid from partisan attacks from Donald Trump and congressional Republicans. This week, I will be introducing new legislation that would prohibit Congress from making devastating cuts to Medicare and Medicaid through the budget reconciliation process. It accomplishes this objective by requiring any legislation that seeks to make certain changes to Medicare or Medicaid to receive 60 votes in the Senate before such changes can be implemented. And of course, these changes include increasing the Medicare eligibility age, privatizing or turning Medicare into a voucher program, block granting or imposing per capita caps on Medicaid, and rolling back the ACA's Medicaid expansion. My legislation builds on the success of an amendment I introduced with my colleague from Indiana, Senator Donnelly, during last January's budget debate to protect these programs. And although our amendment did not pass, we came pretty close, and 2 Republicans joined us in supporting it. It's nice to know that some of my Republican colleagues are concerned about seniors, children, and working families who rely on Medicare and Medicaid every single day. I think it's just astonishing that as we're talking about cutting Medicare and Medicaid for millions of seniors throughout our country, hundreds of thousands in Hawaii, that These programs or these kinds of changes are being proposed by the very president and the people in Congress who gave the richest 1% of the people in our country and corporations a huge tax break. And by the way, the president is talking about giving the rich people in our country even more of a tax cut. It's just astounding to me that while all of that is happening on the one hand, on the other hand, they propose changes to two huge programs that millions of people in our country rely on. Where are our priorities? They are definitely misplaced if we go along with these schemes. I call on my colleagues on both sides of the aisle to join me in this fight to protect these critical social safety net programs. Mr. President, I yield the floor.